Let's talk about why American healthcare costs are so high. There's a recent example that really brings this front and center. The Endocrine Society released a statement that recommends against screening for vitamin D levels. They're saying that testing for vitamin D levels should not be included in normal annual screenings. And they recommend against this because there is no consensus on optimal vitamin D levels, and there's no consensus on how to effectively increase vitamin D levels. And I guess from a very narrow-minded point of view, that makes sense. But really what the Endocrine Society is saying that we're not going to deal with vitamin D levels until they are so low that you come crawling to the office because your body's fallen apart because you have a vitamin D deficiency. Even though that could have been prevented by annual screening. I have seen a lot of patients that come to me with some mystery illness that no one can figure out. They've been on multiple medications, they've tried all of these different treatments, and nothing has worked, so they come to see me for just something else. And it turns out they have a vitamin D deficiency, so we start to increase those levels and they start to feel quite a bit better. So these patients were jumping from doctor to doctor, relying on expensive therapies and treatments, and the solution was increasing the level of an essential vitamin that we know our body needs. It's pretty well documented that levels below 20 nanograms per milliliter is considered insufficient or deficient. And toxicity isn't really a concern unless we're hitting levels above 100 nanograms per milliliter. The optimal number in between 20 and 100, who the heck knows? There are a ton of different theories. A lot of people have their own thoughts on it. I have my own thoughts on it. And for the record, I shoot for between 50 and 70 nanograms per milliliter in most cases. People that have low levels of vitamin D can experience some really extreme symptoms. Aches, pains, muscle weakness, depression, generalized fatigue. They just feel terrible. And a lot of those people are diagnosed and treated with other diseases where just simply raising the vitamin D levels would solve the problem. So first of all, this really sucks for the patient because they are being mistreated. They're being misdiagnosed. And second of all, this is a really expensive process. We're talking multiple doctor appointments to figure out what's going on. We're talking paying for prescription medications, which are often really expensive. And sure, sometimes insurance will cover those costs, but it's still really expensive on the back end and adding to that American healthcare cost and driving up those insurance rates. And this reluctance to focus on prevention in American healthcare is really what is driving up those costs and what's costing Americans their health. And so I suppose if I'm the Endocrine Society, I understand why they wouldn't recommend annual screening for this. Because if you rely on screening for vitamin D levels, you're forced to make a decision about individualized healthcare. And that's generally how the conventional healthcare system works. It's not based on you, the individual, it's based on kind of yes or no answers that we can put into an algorithm. And I'm particularly heated up about the vitamin D thing right now because I just read the Endocrine Society recommendation. But this is not only occurring with vitamin D. I suppose we'll leave that for another video. For now though, I'm going to strongly disagree with the Endocrine Society and highly recommend that you're checking your vitamin D levels regularly.